Hi everyone, I'm Amber Jen. I'm a student at the College of St. Benedict, currently pursuing my nurse practitioner degree. I hope you enjoyed reading the blog that you read above here, going over complementary therapies during pregnancy. I just wanted to touch base a little bit more on those. So alternative treatments and complementary treatments are pretty much the same thing. The two words can be used interchangeably. So as listed above, the first one I started to mention is acupuncture. Acupuncture is something that can be safely done by a professional while you are pregnant to help relieve some of the symptoms that you may be experiencing. Dr. Deborah Wilson in 2021 wrote a great article stating that acupuncture can help with maternal stress, fetal stress. It can even help with nausea, some anxiety, fatigue, depression. It's just very important that you go to a professional when seeking this type of care. Moving on to aromatherapy, that's something that I personally really liked using during my pregnancy. There's a nurse practitioner, Emily Cisco, at the Mayo Clinic, who wrote a great article back in 2016 on the benefits of aromatherapy while you are pregnant. One of them being lavender. So either the oil itself or a patch. It can be diffused or just sniffed with the patch. That can be great to help lower anxiety. It can also help with nausea, any vomiting that you may be experiencing. During my recent delivery, I did decide to use a lavender patch, and I think it did help me get through labor. So I would suggest doing that. It's non-invasive and it can be beneficial to you. It might be something that you just have in the room and you don't even realize is helping you. Another one is peppermint. That's a great scent as well. That can help decrease headaches. It can help with nasal congestion as well and muscle aches. Just making sure you're talking to your provider on how the best way would be for you to use those. Something that I did learn from Emily that I thought was very interesting in her article is that peppermint can actually be used postpartum to help mothers empty their bladders. So that was pretty cool. Moving on to the chiropractic and massage area, those are both great areas that I would suggest every mother should go, expecting mother should go get a prenatal massage, get adjusted. That just helps naturally with baby coming out. Herbalism, I'm not going to touch too much on. If you've read the article above, Moser, Wu, and Robinson from 2019 and Brummer in 2021 do great at explaining everything that you would love to know about herbs. Take a peek at the article above to make sure you're up to date on which ones are most beneficial. The last thing I want to talk about is mind and body interventions. So most of these are completed by a trained therapist. Your biofeedback, progressive muscle relaxation, and guided imagery should all be completed with a therapist's help, but it's all tactics that can be used throughout your pregnancy and then through labor too. So I would suggest doing that. Yoga is awesome. If you're a big yoga person, it can help prepare the body for delivery. I hope this helps you. I hope you enjoyed the article. I hope you enjoyed this video, that you're able to take some of these possible alternative therapies back to your provider to talk to them about options that would be best for you and baby during your pregnancy, throughout it, during labor, postpartum. They're all great options that you can use. Thanks for taking time to read my blog, and thanks for joining in for this video.